Hi, this is Dr.RUkmani Choudhary and you are watching Dr.RUkmani's Health Update. My today's topic is inguinal hernia. In this video, I'll be talking about inguinal hernia. What is inguinal hernia? What are the causes, risk factors for inguinal hernia? What suffering, what are the signs or symptoms you develop in inguinal hernia, risk factors, causes, sign or symptom, diagnosis, what are the diagnostic criteria, prevention and outlook of inguinal hernia, best effective homeopathy medicine and emergency medical condition, that is surgical point of view. You are requested to watch complete video for complete information. If you are watching first time, please press the bell icon to get notified and don't forget to subscribe my channel. Thanks. What is inguinal hernia? See, I have uploaded hernias video on my Hindi YouTube channel by the name of hiatal hernia. So hernias are the problem, the condition kind of bulging out of any body part, any internal body part bulging out or protrusion due to weakness of your muscles. So this is a kind of inguinal hernia, and inguinal is the term that is used for the particular area, means your inguinal canal. So you can have any type of hernia, like you can have umbilical hernia when if it is due to protrusion of your umbilical region, and if it can be femoral hernia, it can be hiatus hernia. There are different types of hernia, but today's topic is about inguinal hernia. So this is a kind of bulging out, protrusion of your internal intestinal tissue from your inguinal canal due to weakness of your muscles near your groin area, lower abdomen region. So these are the reason who are at the risk. What are the causes, who have more this problem? See, men are more prone to have this problem, but yes, women can develop. And yes, there are certain risk factors like genetic. It runs in family. It runs in family. There is a obesity, overweight. If you are overweight, if you are prone, you can develop this condition. Chronic constipation, chronic long-standing constipation. If you are having constipation for a longer time and there is a pressure and your muscles are weak, so yes, you can develop this inguinal hernia. Chronic cough. If you are having cough problem for a longer time, in that case you can develop this problem too. So this can act as a risk factors, your chronic constipation, chronic cough, and your family history and previous inguinal hernia. If you had earlier inguinal hernia and you got it treated, and yes, it can develop again. There is a tendency of developing inguinal hernia or risk factors that leads to Now, types of inguinal hernia. There are 4 major types of inguinal hernia. One is indirect inguinal hernia. It is seen in the premature baby, premature birth, and it is due to before the closure of the inguinal canal. It is seen. Second is direct inguinal hernia. That is again common and it can develop at any age. Hernia is due to weakness of your lower abdomen muscles. So this can develop. Incarcerated inguinal hernia. Incarcerated inguinal hernia is developed when the hernia is not reducible, means you cannot when you push and there is no reduction in the size, then it is called incarcerated. Usually what happens, if there is a bulging out of any part, you press, it goes back, means that this is a reducible. On contrary, this incarcerated hernia, the size is not reducible, you cannot reduce it. That's why it is called incarcerated inguinal hernia. And if in incarcerated hernia there is a blood supply, means there is no blood circulation, no blood supply in your intestine, the part that is in the incarcerated hernia, so it is a medical condition and you need medical emergency right away. So inguinal hernia, if you are having this condition, what suffering you can have, what are the the common feature, the patient tell that they feel some bulging out, something is coming out. At times it is reducible, at times it's not reducible. There is a heaviness, there is a bulging out of your intestinal part, and at times there is a sharp pain you can feel, and it comes out when you when you are in the standing posture. What are the diagnostic criteria? Your doctor diagnose the condition. Easily diagnosed. You are asked to stand up and you are asked to cough. When you cough, there is just the part that comes out. So this is a clear-cut diagnosis that you are having this problem. Taken for the proper. Now, what are the prevention? How you can prevent this condition, and what are the outlook of the disease? See, in my all videos, I always discuss about causes and risk factors, and I always focus on the prevention as well. So if you know your causes and risk factors, you can easily prevent all the medical condition. If you are overweight, you can can control your weight so that you have, you don't have any chances of developing this condition. If you're having cough, so don't delay in your medication, just control it ASAP so you don't have this condition, right? So control your cough, control your weight. Treatment, see, in mild or moderate cases you can take homeopathic medicines help, but if the case is very severe, then you can go for surgery. Means you are having strangulated hernia, in that case you can go for surgery. Surgery will be the primary option for all strangulated case. The moderate or mild one, there are so many medicines in homeopathy. This is the Hernia. This is in the drop form. It is given in the all type of hernia, so you can use this medicine. This is in the drop form, liquid form, so you can have some lukewarm water, like 1/4 cup of lukewarm water, and you can add medicines 15 or 20 drops. You can mix it, you can have it like minimum 2 or 3 times having meal. And if you can't take medicine before having meal, even you can take after having 30 minutes of having your meal. If you're watching on YouTube, I have provided medicines link on the description box. You can check and you can buy medicine from there and you can start your treatment. The next medicine, Silicea in homeopathy, is well known for hernia. Like if you are obese, if there are case of overweight and obesity, and you are having constipation, you are chilly, in that case you can use Silicea in 30 or 200 potency. These are the oral form of the medicine, right? So these are the oral form of the medicine. You can use with the help of dropper, like 2 or 3 drops direct on tongue before meal, twice or thrice. Again, Nux vomica is well known type of hernia. Like in all type of hernia, Nux vomica is given. It's the case where you have long standing constipation, and due to that you have hernia, you are having weakness of your muscle. So in that case you can use Nux vomica 30 or 200 potency, minimum dose, like 1 or 2 drops twice or thrice before meal direct on tongue. If you have any burning sensation, you can add some water in that, so you don't have any problem. Lycopodium is the medicine that is given when you have gastric problem, your stomach is very much disturbed, you are having bloating, flatulence. In that case you can use Lycopodium in 30 or 200 potency, like 1 or 2 drops twice or thrice. Rhus Tox is known in homeopathy for like muscular tonic, like arnica is given in muscular weakness. Same way Rhus Tox is given in all muscular wear, tear, weakness, so you can use Rhus Tox, oral form of the Rhus Tox medicine, and you can use ointment form, cream form, pomade form of the medicine Rhus Tox, and you can apply on the affected area. It will relieve your symptoms. So Rhus Tox in 30 or 200 potency, 2 to 3 drops twice or thrice, oral form, and application form pomade you can use. The last, Silicea is very good medicine in kids, in children who are having headstrong, they are chilly and constipation always, and they fall sick easily, they are having recurrent cold, cough. Kids, you can give Silicea to them, like 1 or 2 drops twice. So hopefully this video can help you. And yes, you can use inguinal support. Inguinal belts are available, you can use for the support purpose. Those belt you can use. So hopefully this video can help you. If you find this video knowledgeable and informative, please like, share. If you are new on channel, press the bell icon to get notified. Don't forget to subscribe my channel. Thank you for watching, thank you for support, thank you so much.